How to know whether your baby's getting enough milk without pumping. Honestly, it's just going back to the basics. Nappies, weight, behavior. And if you're really worried, stare at them and look at their suck and swallow pattern. Nappies. From about 1 week old, your baby should do at least 6 or more really heavy, clear, wet nappies every 24 hours. Weight. In the first 3 months of your baby's life, they should put on between 150 to 200 grams every single week. And you will need to go weigh your baby, maybe at your local child health center or the same set of baby scales that are sensitive enough to help you pick up these weight changes. Your baby should wake up when they're hungry and show you feeding cues and even cry when they're extra hungry. You should see a change in behavior after they've had a feed. If your baby was crying, you've just fed them and then they stop crying, that is a change in behavior. Your baby's arms and shoulders might be less tense, where you are touching their hand and then their arm just falls down. That's usually what people mean by when their baby's milk drunk. If your baby looks milk drunk, you know they've had a good feed. And number 4, suck and swallow pattern. So it's normal for baby to feed between 8 to 12 times every 24 hours. Some babies have smaller feeds more frequently. Some babies have bigger feeds less frequently. If your baby is feeding super frequently or for a really long time every time, and it is starting to bother you, it might not be that they're not getting enough milk from you. They could just be doing a lot of comfort sucking when they're breastfeeding. So next time your baby feeds, stare at them. They usually do some comfort sucks to begin with at the start of the feed, and then they'll actively suck, swallow, breathe when you're breastfeeding them. And then after that, and usually after about 10 to 15 minutes of active sucking, they go back to the comfort suck where they're just doing flutters. When they're doing the flutters, they're not actually getting a lot of that feeding. So you can try to maybe take them off if you have other things to do or it's really bothering you, especially if it's causing nipple pain. Now, there's nothing wrong with comfort sucking. It's actually probably one of the most enjoyable parts of breastfeeding. So if both of you enjoy it, feed away. If one of you is not enjoying it, which is probably you, that is when you can delatch baby and just try to have a cuddle.